Okay, now Consolo's the co-host officially. We can get started and we are recording. So this afternoon's session is on accessing and referring resources. As I mentioned earlier in the session earlier today, we'll be getting into more about how to go about building a community directory and whatnot. So just a reminder for those of you joining from a different location, please use headphones and mute yourselves. Again, if you have another device in the same room, either in Syracuse or Schenectady, please make sure that device is muted so we don't get an echo. And remember that this session is being recorded, so please act accordingly. So in our session this afternoon, we will discuss what are community resources and what is the role of community health workers in helping people access those resources. We'll watch a video about the Health Angels with providing help for some of society's most vulnerable people. We'll go through an activity where we will have you create your own resource directory or talk through the process. And then we'll talk more and get into more detail about what should go into a community resource directory. We will highlight some local resources that we were able to find, and I would love to get your feedback on this portion because you all are so plugged into the local communities there in Syracuse and Schenectady. We'll talk about making connections and using that knowledge of the client that we talked about gaining this morning in bias, cultural, and values, and how we can use that to better help our clients and help to refer better, more effective resources to them. And then before we close out, we will watch a video about supportive housing and the role that connecting someone with a variety of resources can have in their promoting their health, their recovery, and their independence. Could I get someone from the Syracuse site to just read our learning objectives for me that we have up on the screen?
Okay, I can do that.
Thank you.
Okay. Learning objective. By the end of this training, you will be able to explain the differences between the resources that require a referral and those that don't. To discuss the role of community health workers in helping community members access resources, use resources directories to find community, local, and national resources, demonstrate effective skills and strategies for working with community agencies, describe the tools that community health workers can use to help people access needed resources.
Thank you so much for reading for us. Appreciate that. We have a lot of ground to cover in this training, and we will get right to it. So first, let me just throw it out there. Let's go to Schenectady first. And just, what do you think of when you hear that word resources or community resources? What comes to mind for you in Schenectady?
Transportation.
Great. Transportation resources, absolutely. I know, at least in the 5 boroughs of New York, there's programs for low-income people to get free and reduced cost transit passes. So there likely could be something similar in your community as well. Anything else that comes to mind?
Food security resources.
Great, absolutely. And some of the things that you were talking about with the 518 free store would come into play there as well. Absolutely. How about in Syracuse? Any thoughts on what comes to mind when you think of resources over there in Syracuse?
Hi, this is Makiko from Syracuse. Resources, what are resources? Things that I can find if I'm in a situation that I need help with. I can look up stuff and see if it's any resource out there that can help my situation.
Absolutely. And that's the attitude that we want you all to be having when dealing with clients out in the community is, not just what do I already know about, but what could I find for you? How can I help uncover some of these resources that are out there that neither of us might know about at that point? Absolutely. Anything else from Syracuse? Yeah, I see a flag waving.
Yes. How about other organizations that are like-minded or have um, um, related services?
Absolutely, yeah, 100%. Looking for those agencies or community organizations that work, we might say, in the same space that we're working in promoting health, in promoting healthy food choices, in promoting access to other resources in the community. Absolutely. Um, so when we talk about resources, we're talking about services that are needed by the community member but are not directly provided by you or the organization that you work for. So we're talking about how can we get you these resources or these services that are outside of my organization as a community health worker. These resources might be clinical, they might require a referral from a healthcare provider, thinking about things like specialists, social workers, physical therapists, talking about real healthcare related stuff. They also might be non-clinical, non-healthcare related, what we would refer to as community resources that wouldn't require any sort of referral from a provider, in terms of like a formal referral, but more of an informal referral in terms of connecting that person with the right people in the organization. This includes things like community organizations, housing services, transportation services, services for food security. All of those kinds of things would be included under non-clinical resources. So when we're focused on the problem of vaccination, and that's kind of the starting point for our conversation, how might community health workers assist people with resources around vaccination specifically? Any thoughts from Syracuse?
Just simply having a wealth of knowledge of your community and the resources that are actually out there. And not to mention the agencies and community partners that are actually helping do the work.
Great, absolutely. Yeah. Anyone else in Syracuse want to add anything?
Looking up where they can looking up where they can go and get the vaccinations, who are giving them.
Yeah, I mean, that's really like the core of this is, you're going to be going out there into the community, into your communities to, help people primarily with vaccination. So you should know where those sites are, who's offering them, maybe what documentation is required, if any is required to access those services, but then also thinking more broadly about other community resources as well. How about in Schenectady? Anything that hasn't been said thus far that you all would like to add?
I definitely think there's I agree with everything Syracuse just said. I think just like definitely, and I think it's been brought up before as well. Just like us being well versed in our positions and what is available to us in our positions, and also how to get information. Like, I think we need to be well versed in how to obtain information that we don't have. So good research so we can have answers to questions, which also builds community relationships, because if someone comes in and asks me a question and I can't on the spot answer it or maybe don't have time to look it up right then and there, next time I talk to them, having an answer for that. Specifically pertaining to vaccination and stuff, knowing even outside of what information packets we might have or whatever, what the stuff that we will have with us all the time or information we'll already know looks like, having a good scope of just our surrounding community and areas, where's the urgent cares, where can you go get tested, where can you sign up for stuff, how can you get in contact with the city, health professionals outside of our position, and having those resources on hand or figuring out how to find them. Feel me?
Yeah, absolutely. And again, I think reinforcing that point that that's the attitude that you should be bringing into these interactions, into accessing resources for people in your community, is not just what do I already know, but what can I find? What can I search for? What can we look for together, right? And sometimes, you can look for resources with someone in a way that is not just helping them access that resource, but also helping them learn how to access other resources in the future. Kind of a teach a man to fish. They can, give a man a fish, teach a man to fish kind of scenario, where we want to be not just connecting people with resources, but also enabling them to self-advocate in the future. Absolutely. So what can community health workers do? Let's nail down some specifics. Community health workers can make sure that the community member has an appointment, and an appointment that will work for them, work around their work schedule, work around their family commitments. Make sure that the person knows where to go, right? Make sure that they have the address, that they know how they're going to get there. Sometimes transportation is an issue. We need to connect them with other resources around transportation to get to an appointment. Make sure that they have the correct paperwork and identification for the appointment. Most places do have multiple levels of documentation and identification that they would require. And the point for this is that allows for people who are undocumented to still access services without providing information that they might not feel comfortable providing. We can follow up with the person and make sure that they get to that appointment or that vaccination appointment that they have made or we have helped them make. And more importantly than anything else that I've said is you can work to address additional barriers that the person might have in following through on the vaccination or the vaccination appointment. So really we want to be out there as guides, as walking alongside our community members and helping to clear the path for them, really, more than anything. Connecting with those services, make sure they have what they need to follow through. So we already got into this a little bit, but I'd like to just tease out a little bit more. How is the role going to be different for you as community health workers when you're helping with someone with a clinical resource, say around vaccination, versus helping them with a community resource, maybe say around food security or housing? So what do you think about the differences in how you would approach each of those different situations? How would you approach those differently?
I think and something that we kind of talked about a little bit during the break, I think our role, and this speaks to the clinical aspect, when we were looking at the health disparities, and the large one was stress in our community. And so our job as workers would be try to alleviate some of that stress in dealing with the right paperwork and all of those things, that if we can take that burden off them, so they just really have to worry about showing up and communicating and getting what they need taken care of, without having to worry about someone worried about their validity of being there, because that's the stress about having all that other stuff, is almost, do I have to get cared for? And yes, they do. And we have to make them feel that way when they go there, and so that they get the best care possible.
That was just one of the best explanations I've heard. Really amazing, and I think you really got to the core of what the role is and how those things are different. Thank you very much. Any thoughts, additional thoughts from Syracuse that you'd like to share, or any of the people who are joining us from another location? Go ahead.
This is Makiko again from Syracuse, and also I would just like to add to what that gentleman from Schenectady said, that also, like, a lot of people, a lot of different of our clients that we're going to have is releasing private information to us. So it's very important that we don't let that personal information get out or leak out to anyone.
Absolutely. Really important point. And we will have an entire session that focuses on health data and how to make sure that that's safe on all of the HIPAA regulations, the health information, what is it, privacy, I forget. We have to do a training on HIPAA every year, and I should know that by now. But yeah, what are those HIPAA protections that they have towards their healthcare information, and how can we make sure that while we're doing all this coordination, while we're reaching out to these other agencies, that we're making sure we're keeping their information safe and protected. Absolutely important. So a little bit more on the role of community health workers. Community health workers, you're not out there medically assessing patients or community members to see what clinical resources they need. Instead, you want to assess what community resources might be appropriate for the person. And you can also make follow-ups and referrals to make sure that those resources were connected to and that they got what they needed out of that resource. When it comes to those clinical resources, though, we're not assessing, we are not determining what they need. However, if someone expresses to you in conversation, I have, diabetes, or I have high blood pressure, right? Or I have any other myriad of, I have bipolar disorder, right? We can help connect them with resources that they already know they need, but might not know how to access. So again, we're not assessing them, but we still can connect them with those clinical resources that they need. So the next thing that we're going to do is watch a short video about basically healthcare ambassadors, community healthcare workers out in a community in the United States. Conzola will take us through this and lead the discussion afterwards.
Yeah, just while you're watching this, think about what resources were identified to help these families, and what kind of qualities the field workers had that helped them get what they needed.
Buenos días. ¿Hay alguien en casa?
The original concept was to utilize the promotoras as the individuals that would be conducting outreach services in these two colonias.
Being a promotora, it means a lot to me because I have a satisfaction that I can hardly say that anybody has, helping people. I help them with my knowledge, knowing the services, explaining to them what are the services that they have, and teaching them how to survive.
All these promotoras offer an array of experience. They're organizers, they're advocates. You've got people that have 20 years of administrative work. Some are nurses, have been doctors in Mexico. Some are attorneys, and then you have some that just kind of work themselves into the promotora concept.
This colonia is a very low-income colonia, and there's a lot of children. They have a lot of children. Families here are very big. I myself have 5 children, ranging from the ages from 10 to 3, and which they need, doctor's appointments, physicals, dental, and they came by and they asked if I needed, transportation or help. And I said, yes, I do,
The housing typically is either a small shack put together by plywood, or just anything that's metal is nailed down to the walls. In some cases, you have just 4 walls and a ceiling, and you have, in that little shack, you have your kitchen, your living room, and your sleeping quarters. You have possibly no running water, no sewer services, the plumbing is lacking. So we were able to go in there and basically go in there and say, this is what we can offer to you through the promotora concept. We can go in there and they can advocate for you, and you will be able to be streamlined into the medical, whatever system that would be, you would be able to be driven by the promotora to make sure that you don't fall through the cracks. The promotoras are literally the angels of services providers because they go into the colonias and are seen as angels. Every time you go back in providing that case management, you'll hear these women, especially the women, say, mi angelita, my angel's here.
All right, thank you. So just kind of the two questions are, what kind of community resources were identified for these families? And if you're, as you're going through, if you want to unmute, you could also address the other piece of this, which is what kind of skills did they have that helped them get the clients and services? If you can address either of those questions.
Housing.
Yep.
Somebody else. Go? Yeah. Okay. So I think that they had knowledge of all the non-clinical resources that were available. They were able to identify the needs of the particular families in that particular community. First of all, because they were Latinos in a Latino community, they spoke the language. Yep. And looking at their attire, they didn't look, right? They didn't come in with, how do you call it, overly dressed, right? They were able to sort of blend in. And they were able to have conversations as if, the lack of plumbing. So they had to have an outhouse that was visible. And they were able to see these things. And they were able to refer. The question I have, though, right? So they were able to refer folks based on the needs, right? Not only plumbing, right? Health, food, the children, right? Were running around barefooted, which I grew up in the countryside of Puerto Rico. That was the favorite pastime. You had to run around, right? Barefoot, and half naked. So,
right. Thank you. And anyone in Syracuse want to add anything?
Not in the room. Anybody online want to add anything?
Yeah, I think we addressed most of it. I'll just say that that one key word that came up there was case management, right? There's a lot of different, some folks needed a lot, right? So a lot of different resources, but transportation, housing, healthcare, but overall the case management that Jeffrey talked about and a lot of you already brought up, that kind of big picture where you're reducing, and I also liked hearing just, as I had the benefit of just sitting here and kind of observing this whole thing so far, that came up from someone, I think in Syracuse, reducing stress, so that these folks have all these different things going on, but you're able to see the big picture, connect the dots and notice something that would help improve their situation that maybe they're not seeing because of they're right in front of it. And I know a lot of us, especially those of you guys who are out there, like you said, they're coming in, not, they have the similar backgrounds in this video they did, and a lot of you guys have a similar background, so you have that experience and you can see the big picture. So I think with that, I'll actually can I have the next slide, Jeffrey? So I think you guys did this in an earlier session today. Kind of we're doing throwbacks to yesterday's presentation or discussion around vaccination. So this next Facts is which COVID vaccine is best? And I'm kind of curious, does anyone, we're talking about Pfizer, Moderna, Johnson & Johnson. Does anyone know what they would say? I think this was addressed briefly in there, but this is kind of an interesting question. Does anyone want to unmute and take a shot at this?
Yes, Cliff Ryan, Syracuse.
Yep.
I think based on the information that's given pertaining to the vaccine is important to assess in determining which vaccination best suits you as a person, because as we know, there was problems with certain vaccines for certain people. So assessing which vaccine would be uh, appropriate for you as the individual person is something that I think we should take in consideration when asking that question of which vaccine is best for you.
Thank you. And Jeff, I want to click once on there. We'll see what the slide has. So basically it says the one that's available to you, but I'm going to come back to what Clifford just said is, everything's authorized. They're all safe, effective. They reduce your risk of serial illness. So it's really what's available. Right. Recently, like within the past 2 months, this was kind of the standard line is any vaccine, they're all great. Like I said yesterday, Johnson & Johnson, they had pulled it for a short while because there's a very, very small percent of people, like 6 or 7 out of several million that had an adverse reaction that was very serious. But getting back to what Clifford just said, more recently, like when past month, the CDC actually does prefer Moderna or Pfizer over Johnson & Johnson. Still, you could get the other one, but you'll notice it's less likely to be available. So if you go get a vaccination, it's unlikely that it's going to be Johnson & Johnson that is offered. In the off chance that someone had some kind of reaction to one of those, they could get Johnson & Johnson. Or if it was in a certain community where it was the only thing available, it's still fine. It still works. I know Jeffrey got it, so it works for him. But I just wanted to say that, overall, it would be, the standard answer up and literally until a month or two ago is whatever's available. And then now it's kind of more like the preferred is either Pfizer or Moderna. But, in your case, you're going to refer them to go get vaccinated and the specifics. But if the question did come up, they're all safe and effective. And that's it. So I'll pass it back to Jeffrey.
Great, thanks.
Let me ask you a question before you do that, because I just heard you say when you spoke on the Johnson & Johnson vaccine, has that been determined to be safe?
Yeah.
And effective as well?
Yep. So it's safe and effective. It's similar to the other vaccines. You need a booster, but this one originally was a one stick, and then that was it. Whereas the other ones were 2. This one now, all of them recommended a booster after 6 months. This one, it's after 2 months that you need the first booster shot. But again, so it's safe, effective, things like that. But the CDC is kind of leaning a little slight preference towards the other 2. And I think it has to do with that very, very slight risk that hasn't come up with the other vaccine, with Pfizer and Moderna.
Okay, thank you.
I would just add to that, Gonzalo, that I am safe and I still haven't gotten COVID. So J&J / Pfizer booster is working for me. The other thing that I would say is they have seen that the protection from the J&J one-shot regimen is fading faster than the protection that you get from the 2-shot regimen from Pfizer or Moderna, which I think is another factor in why the CDC is now recommending Pfizer or Moderna, because we have to get a booster after 2 months with the J&J. So the protection is lasting longer, up to 5-6 months with the other one before you need that booster. So what do you think? And this is open to anyone, so unmute yourselves and shout out your answers. What is needed to make a successful connection to clinical or community resources for your community members? What do you think is needed to make that connection? Go ahead.
Community trust.
Absolutely. Community trust is key. Both trust that you as a member of the community are coming to them with accurate information, and that they can trust that they're going to receive the services they need from whatever organization you refer them to. Yeah, absolutely. Anything else?
To go off that, I was going to say that, but I also think that in order to do that, in order for us to have effective trust within our communities that we're going to be working in the communities that we live in general, and I think this goes across the board, we not only have to have great rapport and connection with our community members, but we have to be assertive with the actual resources. We have to actually advocate for people, which can be uncomfortable because it's inherently going to mean there will be a certain level of conflict at some point. because of how inaccessible a lot of things are. But it also means that we should try to have, like, in my opinion, like, well-formed connections with the actual resources. So, like, say I'm trying to call a resource someone who, like, needs something specific, I should have already spoken to that resource prior to the day I'm trying to do that. Like, once we come on board, I feel like we should be calling around to at least the majority of resources and introducing, like, hey, this is the position, we're going to be reaching out to y'all, please expect that. And that way it honestly makes it easier to not only have, like, that smooth connection, but also to be assertive when they're not treating your client correctly. You feel me?
Yeah, being able to push back a little bit and say, you know what, hey, you're not giving them what they need. How can we get them what they need? Absolutely. Anyone else want to add anything from either Syracuse, Schenectady, or other locations? I think you all really covered it. And so to break it down, you guys got it right on the nose. What is needed? Knowledge of what resources exist and relationships with the people and organizations that are in your resource directory at those different organizations or resources. When it comes to finding those resources, and you just led into this really well with your comment, when you begin your job as a community health worker, you'll need to learn about what resources are available in your community. And one way to stay up to date with that information is to have an up-to-date resource directory or list of key community resources. So we are going to have a short activity. We're going to get you into small groups here. Let's say groups of small, either pairs or groups of 3, depending on how many are in your location. If you are coming in on the phone or on your computer or iPad from home, you just think about this and be ready to add to the conversation when we come back together. So the scenario here is you want to pretend like your supervisor has just given you the task of creating a new resource directory. What do you do? What are the steps that you take in going about creating and then hopefully using that resource directory? So let's take about 5 minutes in our small groups to talk about this and see what each other thinks. And then when we come back together as a larger group, we'll have you all share what you came up with. Okay, we're almost done with our time for this activity. So if you want to take the next minute to wrap up any conversations and come back together, we'll get back and have our group discussion in about 1 minute from now. Okay, if you're still having conversations, please wrap them up. And we would love for someone, let's start with Syracuse and have some people in Syracuse share what you came up with. What would be your process or your approach to this task?
All right, we'll start in the room at Miss Brenda's table.
Great.
Say your name before you guys.
Hi, Tika. We put 211, 911, the food bank, the health department, Salvation Army, Bureau Health, Peace Corporation, Catholic Charities, Park and Recreation.
Okay,
Great.
second table.
Great, thank you.
Y'all got all of that, or what?
We got some of what they said also. Central New York Food Bank, our local churches, our local community centers, shelters, schools, ourselves being used as giving away food, clothes, things like that.
Yep. Third table.
We have some grassroots organizations, Rise Above the Streets. CNY Clothing gives away food every week. Peace Corporation, Mary Nelson Food Bank. We have the Rockma Clinic, which is a healthcare clinic, along with the Syracuse Community Health Center and Brady Farms.
Anybody online from Syracuse want to add anything?
Yes, Makiko. We also have Catholic Charities.
Great, thank you.
Yeah, you can use interface and other churches, and you can use individual too. You can ask, or any connections.
Absolutely, absolutely. And it's, again, not just what we can find online or not just what we can find in existing community directories, but also connecting with your own networks, whether that's through church, through school, through other organizations you're a part of, and use those as resources as well. Absolutely. Let's go to Schenectady and see what you have. If you have anything different, especially, we'd love to hear that.
I made like a short little list. My ideal about like how I would go about this and like the group in general. We talked about, so like first things first is that in an ideal situation or setting, we would have already listened to like a wealth of like community needs up to that point. So we could also move on in like an informed basis and not just what we already were trained to know was available to us. And then the second step would be researching what is even has ever existed in the realm of resources, and that specifically includes not just calling around, also calling around, but not just that, including like websites online, Googling stuff because Google's free, and specifically grassroots organizations as well. And then it would look like calling, checking in with those resources to make sure that they're still available, what the like needs are, how you get into it, stuff like that. Then record it down with all the info, compile the list in a sensible but also easily accessible ways, not only for people you might be giving it to, but so that you can do it on the spot. And then have it on hand when you're like working with people and continue to add to it on a need-to-need basis, in my opinion.
Great. That's awesome, both touching on kind of content, but also really diving into the process of what does it actually look like step by step to build out this directory of resources. Really great answer. Thank you. Anyone else in Schenectady?
To piggyback off what they said, just as one more thing, I came at it from a person who necessarily wasn't going like, all right, boss, you gave me this idea, but I'm not the person who has been in the community, so how am I going to go do it? And the first thing I would do is use the people and the resource around me to get a lot of that information. So for those folks who might not be as versed, do not feel like you have to come up with it. You are around great people in the community who are in this project. Use them, use that knowledge, and that will help you also gather something like that if you're in a position where you have to do that. Don't feel like you're alone or have to come up with it by yourself.
Absolutely. And I love what you said about using the resources around us, right? There's a lot of activists in the room. There's a lot of people in the room with you who are really involved in their community. And you all are going to know better than anyone else what is out there and how to access it. Vontrice, I saw you had your hand up, but then put it down. If you have something to say, please chime in.
No, so I'm from Schenectady, and I just would like to say that the way I would do it in creating a new directory is I would take a look at the different areas where people would need the resources and maybe get a couple of resources per, I guess if you want to say category or department, so that when you are working with different types of people or who need different types of resources, not just the food, the shelter, whether it be they need medical assistance or like early intervention or like those, I would categorize it by different areas and have like a set little catalog to be able to pull from when presented with the situation.
Absolutely. That's great. And, you know, hearing what you all are saying and thinking about how I might do it, the first thing that popped into my head was create a Google Doc or a Google Sheet that has a list, that has contact information, that has websites, that has maybe what region or what areas of a region they serve, right? All these things can go into that. Really, really great discussion. One kind of starting point that I like to bring up that I don't think was raised, or maybe kind of raised, is find out if it already exists. Look for existing organizations and resource directories. A lot of the organizations that work in communities will have resource directories of their own, right? That you can go straight to that organization and find their resource directory and build off of that when creating your own. You might have access to them in some of the organizations you're a part of. definitely, ask each other, ask supervisors or managers what is available, what's out there. And I think, it could be a really great collaborative tool if you all were to put that together into a Google Doc or a Google Sheet or some other type of shared document, and then you all have access to that when you're out in the field, out in the community, and you can pull up those resources and help direct people towards them. Really, really great discussion. Thank you for all of that. So just to kind of hammer the point home a little bit, don't start from scratch. Find out if your organization or other organizations in your community have their own resource directory. Many staff members will have their own kind of short list that they use because they like a certain organization or set of organizations. Maybe they've had more success in actually getting people the services that they need in the past. So finding out what are your colleagues' go-to organizations? What are the ones that seem to always deliver on their promises, and go to those first. Think about and talk to others at your organization and in your community about the needs of the community. Again, we've touched on this before. You all are activists and very active in your community, and you all have a better idea of what's out there probably than Conzolo or I would. And again, gather information for the directory. So maybe you just find out a name of an organization, but it's going to be on you to go dig deeper and find that contact person, right? Who can I put people in touch with? Find out the phone numbers, the emails, the hours of their walk-ins availability, whatever that might be, so that you can really deliver these referrals effectively. As you're creating these directories, it's a good idea to organize that information into logical groupings that suit your community's needs. Maybe, as we talked about, by geographic region or by the type of services that they offer. It's a good idea to contact each organization to confirm the services and placement within directory groups. So as someone had said earlier, they might not offer those services anymore. They might have changed. They might have changed their hours, right? So follow up in phone or in person to verify that information. And wherever possible, this may or may not be possible for this group, for this project, but if possible, develop a partnership agreement with community resources to strengthen those collaborations. And really what we mean by a partnership agreement is just a set of working guidelines that both organizations agree to of how we're going to refer people to each other and how we're going to interact with each other as organizations. So we wanted to take a moment, and I feel like after listening to you all for the last 2 days or so, I feel like our resource directory is probably going to pale in comparison to what you all could create. But we just wanted to bring up a few different resources here that are available in your community and share some of those with you. Okay, so we're going to get started back up. And as I had started talking about before Conzolo reminded me we were going to take a break, was just looking at some of the local community services that are available. And I will say this much, the government websites are pretty lacking in terms of community services in a lot of ways. I think one of the big blind spots of a lot of these is, as we've talked about, the grassroots community organizations that might not have a paid office space or web presence or any of these things, but do a lot of that on the ground work. And again, those are the kinds of things you're going to have to rely on your own knowledge of the community and each other's knowledge of the community to build out. But for Schenectady, right, Schenectady County has a page with community resources on it. There are some substance abuse, substance use, organizations that are listed here. Also some mental health resources here as well. When it comes to mental health resources, I really like going to NAMI, the National Alliance on Mental Illness. And they have a lot of great different resources that kind of take into account the whole person and the idea that, any type of resource is also a mental health resource in that it will lower stress. It will help take out that worry and anxiety around worrying about some of these basics. But great listing here for addiction agencies, other benefits and entitlement programs that you can help connect people with different types of public assistance, case management for adults with different conditions, children's mental health services. There's a lot of different resources here on the NAMI website specifically for Schenectady. So really great resource and a great place to kind of start your search and then build off of that and fill in any gaps that you notice for your community with especially some of those grassroots organizations. For Onondaga County, we also have a county website that focuses in on mental health services. There are other services available also. Great listing down here of kind of quick access resources that you can come to. Again, just like with Schenectady, Syracuse has its own NAMI chapter website that has links to state and other resources. This one's not quite as well built out as the Schenectady one, but it does also connect to 211 CNY for Central New York, where there's the ability to search by topic or type of assistance, as well as zip code or county, and really great resources down here where they can connect you with different organizations around food, mental health, healthcare, housing, addiction, transportation, employment, disaster relief, government, legal services, military and veteran services. So all across the board here, there's a lot of resources out there that you can tap into. And we just wanted to kind of start the conversation there by bringing up some of those resources. So we've already talked a little bit, and when we were asking you to kind of come up with your process, a lot of you came up with a lot of the different organizations that you would put in your directory to help your community access these services. Maybe, let's say, of things we haven't already discussed, are there any things that have been uncovered for you or that have been ideas that have been sparked in your brains of other things that you might include in your resource directory? And we'll open this up to anyone who wants to comment.
Teenage runaway programs.
Okay, that's great. And yeah, definitely an issue that, you know, there are resources out there for teenage runaways to help connect them back into their community and or to get them services that they might not have been getting in their home, that they might, one of the reasons that they might have left is that they felt they couldn't get the services they need. I see another flag in Syracuse. Chime right in.
How about domestic abuse?
Mm-hmm. Absolutely, yeah. Domestic abuse resources, women's shelters, support to leave an abusive spouse or partner. Definitely all really great things to include in there. And again, the kind of things that you might, that's not what you're going there for, right? You're not going there to help them with, you know, help a teenage runaway gain access to resources or, you know, whatever it might be. But these are the things that you can help with when you get that contact. We're talking about vaccination and these other issues come up. I'm not worried about vaccination because I've got this problem right here. Well, let's help them with that problem. Let's help them solve it. How about in Schenectady? Anything that you want to add to the conversation?
Yeah, I was going to say it's not normally or along the line of some of the stuff we've been talking about before, almost a social security, you know, festivities, things where people of like culture and things could get together and kind of strengthen each other and bolster the community. That's stuff that, you know, we could be a resource for as well, because a lot of that strengthens the bonds and things that have going on in the community.
Yeah. Sorry, go ahead. Continue.
I just want to say I definitely agree with that. I think that also would work really well if we're making connections with like grassroots organizations or just like organizers, artists, even like just building an actual like foundational community sense would be like really dope. I also wanted to add, I had this idea earlier when we were all talking, I think in like the first part of the training earlier this morning. Maybe either setting aside like budget or connecting with organizations or resources that already kind of do the work, but like name changing, specifically for trans people, but also for domestic violence situations or situations like just with people who need to change their names. Cis people need to change their names sometimes. There's dangerous situations you can be in, but a huge barrier for like trans and gender nonconforming people is not going to even try to get healthcare because you can't legally afford to change your name, and thus you're going to be dead named, misgendered, etc. That is a huge boundary. And inaccessibility. And I think it would be so cool if we could like find those resources and like compile those, because no, that might not affect everybody, but people who don't even think it doesn't affect them, it might actually also help out, because name changes and stuff that applies to trans people is not only usually just for trans people, like affirming surgeries and stuff like that. Cis people do those too, and I think that would be really cool to have like those resources compiled, because a lot of people think you have to go to like New York City to like or LA or like these huge places to have those resources, but they exist. It's just you have to find and compile them.
Absolutely, absolutely. And I liked the part that you said about, right, it's not just, name changing is not just for trans people, right? It can help a variety of different people who want to change their name for a variety of different reasons. And it's one of those things that it's kind of like you don't know you can help more people until you start helping more people. And these things are, I like to think of the phrase like a rising tide lifts all boats. Not always true in our society, but I think in these kinds of cases, if we're promoting and making more accessible these kinds of services for one group of people, say trans people, we can also be lifting up and helping out people in different situations as well. Anything else from either Syracuse or Schenectady that you'd want to add to this conversation?
Right. So, like services that would enable community members to finish their GED, upgrade themselves for skills, computer, or as Eric pointed out, finishing their degrees. You know, many have not finished their degree. Maybe that is something. I mean, the training and upgrading program, right?
Absolutely. And you're speaking my language, because that's a lot of the work that we do in our organization, right? Is connecting people with education services, helping them get their GED, or we're now using the term HSE, high school equivalency, instead of GED, because we don't, you don't need to know about that, but there's a test that's no longer used that's called the GED. But yeah, absolutely. And I think, you know, the number of people who start a college degree and never finish because of finances is enormous, right? And there are ways that we can help people navigate. There are organizations that can help people navigate these systems which have built-in oppression in them to, you know, achieve these goals, to get that high school equivalency, to finish that college degree, to get engaged with, you know, job skills training, whatever it might be. You know, all things that, again, they're not in the job description of a community health worker, so to speak, but they're in that kind of broader, big picture approach of how can we help people? How can we be a resource to the community? Absolutely. Anything else anyone else wants to add before we move on?
Yeah, I do. This is Amy in Albany. I just wanted to say that in every Department of Labor across the state, there are workforce development specialists that have grant money called WIOA, which is Workforce Investment Opportunity Act money. And I believe it is up to $2,500 to go towards a certificate type of training, a CDL license, a CNA, something to get you back into the workforce quicker, but at a better income. I used to administer those funds, and with this group, I could train them to how to access those funds, because they don't necessarily advertise them, but they're at every Department of Labor across the state.
Absolutely, yeah. The Department of Labor is actually a really great resource. We don't always count on government organizations to be helpful and actually make a difference, but the Department of Labor does definitely. In New York City, they call them one-stop centers, but they have these job centers, skill centers across the state that people can access. Absolutely. The other one thing that I would bring out of this discussion is community colleges and educational opportunity centers are a huge resource. Most low-income people can go to community college for free, and educational opportunity centers are another resource. They're run through the SUNY system. In New York City, they're run by CUNY schools, and they are another great resource for what we've been talking about: skills training, certificate trainings, becoming a medical assistant, becoming a CNA, getting your high school equivalency, learning computer skills, all of those kinds of things. There's a lot of resources out there for.
Just not a proprietary school.
No proprietary schools, no for-profit schools.
Stratton's, no, right.
Nope. That's another thing that we're big on in our organization.
But there's also barriers in, like, even low income people, even poor people that can go to community college for free. They still, like, depending on their experience and their intersections in the reality and all of the things, like, are still a huge hurdle for them to go to school. So, in my opinion, it's not. If it's not widely accessible to the people who need it the most, then it might as well be inaccessible, and it's not as bad. It's not just very valuable. Like, in my opinion, I know tons of poor people who would love to go to school, but have children that they can't find childcare for, and transportation issues, and literally all of the things, and the time that it's going to take to go to community college opposed to having a job and being able to pay your bills. So it's just in my opinion.
No, I 100% agree with you on that. I will say, tuition cost is not the only barrier to education for people. There are many, many barriers, and childcare is one of the most common. Some community colleges and other schools geared towards adult learners are starting to kind of do better with this stuff, but it's really, really slow going. And I mean, in the Bronx, out of our New York City offices, we offer some programs where we offer childcare right alongside them, because we know at our organization that this is a huge issue. But there's not always funding for that. There's not always space for that. And I think those are things that, as activists, you all need to keep beating the drum to, call these things out. And, as educators, we push our educational partners to try to do the same.
I have one. Now, because
go ahead, Conzolo. Conzolo's an adult ed whiz, so he's got something to say.
Well, yeah, just one thing didn't come up, but I really like the education stuff. Is people with like high school equivalency or high school diplomas from other countries that aren't recognized here, or they're having a hard time getting those validated. There's different organizations, so connecting them with that, or they might have college degrees. I know a lot of people who are they're from somewhere else. They come here and then they have such a hard time with that. Then they end up trying to do the GED or the high school equivalency, which is a challenge because it's not their native language. Then they're kind of stuck, even though they might even have a bachelor's degree or something like that from other school, but they have a hard time getting it recognized here. So they're starting, at a different place. So that hurdle, to help them overcome that, there's resources around that to help getting those recognized. I just want to point that out as something that can really kind of fast track them to getting where they want to go. If it's just the focusing just on the English language piece, might be where they still might need to do that, but at least they have that credential already recognized. So they don't have to go back and take the our high school equivalency test. And in Massachusetts, we call it the HiSET, is one of the main ones, or the GED, and it's different places, there are different things that can help them get into. It's like a prerequisite before you can even get into college. But meanwhile, they already have that, or they just can't get it because they're Haitian and their school that no longer exists and they can't get the records. So but there's ways, there's other resources to get them connected. Just want to plug that in there.
Absolutely. Thanks, Conzolo. So We've talked a lot about building these directories. We've talked about how we would approach using them, what we would do to kind of access information about grassroots organizations that might not be listed on the big government websites. What do we include in a resource directory, though? So again, I think doing some sort of shared document that can be used by the team in Schenectady or by the team in Syracuse would be a great idea here. Things to include are like the name of the organization. As I mentioned before, a contact person. Who can you put people in touch with that can actually help them rather than just giving them a web address? The address, where are they located? What's their telephone number? What's their web address? Get them all the contact information for this organization or organizations, including a brief description of the services offered by the organization. And as we talked about, check back with those organizations to make sure all of those services are still offered. If it's a medical facility, what types of insurance do they accept? Do they accept Medicare and Medicaid? Most do, but you want to be sure. Including things like directions via public transit. What bus line runs by there? What languages are spoken by their staff? And what should the patient bring to any appointments with that organization? Do they need an ID or do they need proof of income to qualify for certain services? So these are all kind of key pieces of information that you should include in your resource directories as you go about putting that information together. So, quick question, we'll throw it out to either Syracuse or Schenectady. What one piece of information do you want to have for all of the organization listed in your directory? What do you think is the key part key point of information? Let's go to Syracuse first. Yeah.
Telephone number.
Absolutely. Telephone number.
The website.
I would say an address.
Yeah.
Telephone, website, address, absolutely, all key information. Do we have any other different thoughts from Schenectady?
Testing sites.
Testing sites, absolutely, absolutely, yeah.
Email address to like at least 2 people who work there. That's in my opinion.
Okay, and let's broaden it out a little bit. And what do you want to have with these organizations to make sure you can effectively refer resources beyond the basic information, kind of more big picture? What do we want to have or establish with these organizations?
Personal relationships, professional relationships.
Yeah, ding, ding, ding. Awesome.
Yeah, communications.
Yes, communication, a relationship, okay? Having a personal professional relationship with someone at the organization is a really great way to stay familiar with their available services. Whether an organization is a shelter, a food bank, a youth mentor program, you're always going to benefit from having a connection with a person at that organization. And that's why having that point of contact listed on your directory is a really important piece of building this directory, because you want to know, who do I want to have that relationship with? Who's going to be the person that can help my clients? Okay, so we talked about building the directory. Now I want you to kind of play out and think about what you would do to build that relationship. What would you do if you were asked by your supervisor to reach out to a new social services agency in the neighborhood to see if they would be a good place to refer community members? So thinking about making contact, making relationships, doing your research and doing your due diligence, what would you want to find out about one of these organizations? So let's take 5 minutes in pairs or groups of 3 to discuss this, and then we'll come back together and share what we came up with. All right, we're going to come back together as a big group. So if you could wrap up your conversations in the next 10 seconds or so, we will start debriefing from our conversations. So again, the prompt was to pretend your supervisor has asked you to reach out to a social service agency in the neighborhood to see if they would be a good place to refer community members. What steps would you take? What would you do in figuring out if this is going to be a good place to refer people? Let's start with Schenectady.
Personally, I would reach out in multiple different ways. So I would call and email. I might even send a letter if they don't answer me. Even if they don't offer anything that like might be applicable to anything, I just want to have that like connection, because I think you can make connections through connections. So like if they can't help me, they might know someone who can that I might not be able to reach without their voice being included. I would also just openly discuss needs versus ability or capacity to fill said need. Figure out what they offer in total, so every service they have and what that would look like, and discuss what we offer and what we need, given like, a day-to-day person-to-person basis. And the other thing is like a mutual partnership. I know it was discussed previously, like community partnerships or like fake contracts and stuff like that, just to talk about like working together, but like a mutual partnership. So it's like, if the phone doesn't go one way, I'm not just calling you, you can call me, because that would make it easier for us to actually rely on each other. And I also said potentially meet in person, which I know is like convoluted because of COVID, but like for certain things, when it comes to like shelters and stuff like that, it's so much easier to be an advocate in person. And in some healthcare situations too, or with landlords or whatever the case may be. That's my opinion.
On the warm handoff.
Love that. Bringing in the warm handoff. Absolutely. Yeah.
Warm handoff in the days.
Anything else from Schenectady before we move over to Syracuse?
To piggyback off of what they said, as well, we would like to, also, because you would know more specifics of the clientele you're dealing with, you could run by some specific scenarios as to, hey, I have this person, they're going to show up there. Can you handle this specific thing? Especially if you know those immediate situations. So therefore, it'll give you a general perspective, but that was just because they hit all the points.
I love that. Coming at them with not necessarily hypotheticals, but kind of like, these are the kind of issues that the people I'm working with face. Can you help them, right? Give them that little bit of a hypothetical and ask them what they would do to determine, is this going to be a real place that I'd like to send people? And definitely love the idea of visiting a place in person, whether that's just to make the connection or to do a little bit of reconnaissance and find out, is the place clean? Is it a place that I want to send people? Are they providing adequate services? Absolutely. Let's move over to Syracuse and see if you have anything that you'd like to add to the conversation.
Guys have anything in the room that you want to add?
Yeah, I do. This is Ali. I'd like to know if the particular organization or service would have any printed materials or any giveaways. People sometimes enjoy giveaways, and I know I keep magnets on my refrigerator so that important numbers I can always refer to quickly. I know where they are. I don't have to guess. I can find them quickly and get to them should I need them, and addresses, etc. So any types of brochures or printed materials or even giveaways that an organization may have, I think would be helpful. And it's also helpful to know the times of operation. When are their services available? Are they available 24 hours a day, or only do they operate during certain hours? Do they operate on the weekend? I think these things are important for people that need services. They need to know when these places are available, especially if they work. If the client works, then it may be difficult for them to get there during the day. So do they have evening hours? So things of that nature, I think, are important to assess as well.
Absolutely. And just to piggyback on what you were saying and take it one step further, if you find that there are organizations in your community that you are keeping referring people to, or that people keep asking for more information about, not a bad idea to stop by their office and say, hey, I do community health work. I would love to get some of your brochures or magnets that I can give out to people who have questions about the kind of services you provide, and carry them with you. Put together a little briefcase of materials that you can carry with you and give to people. Again, because not everybody wants to get a web address. Not everybody wants just a phone number. Some people want that physical information that they can hold and touch. Absolutely. Anything else from the Syracuse side? I see a flag waving in the back.
Yes, Makiko here, from Syracuse. Also, I would just like to add that also, like, if I was me, I would like to add how they talk to you. Like, you got to be friendly. You understand what I'm saying? The way they talk to you and how they present themselves.
Yeah, absolutely. As we've kind of has been mentioned, there are some attitude issues, I think, often seen in the social work space. And how are clients that you refer over to them going to be treated? Are they going to be treated with respect? Are they going to be treated in a way that is equal, regardless of what they're bringing to the situation and to the table? Absolutely, good idea. I see a flag in the Syracuse room, so let's go to you next. Makiko jumped your spot.
I would like to know the turnover rate on referrals. Like, how long does it take them to get somebody in? Because you don't want to refer a client and they get lost in paperwork and BS, pretty much.
Yeah.
Like, you don't want them to get lost, because then you lose them and they lose trust in you. So the next time you go back, if you can say, hey, I can refer you here, you'll have an appointment within 3 to 4 business days.
Right.
I think that's better for a client versus saying, I can refer you, I just don't know when you will get seen or when everything will happen for you.
Yeah, we don't want people to fall into a black hole of referral, right? Where they just fall through the cracks. Definitely a really good thing to know. And, it's also a good thing to kind of consider when we're referring people to different agencies. If we have an idea of how long it takes people to get back to, like you said, you can prepare them. If an agency provides really amazing services, but they take 2 weeks to get back to people, that might be okay as long as that expectation has been set already with the client that you're referring. All right, so we are getting close towards the end of our time, so I'm going to keep things moving just to keep us on track. So everything that we've been talking about in this last discussion is really focused around making a connection, right? So, look on their website to try to find out who you could contact if you don't have an existing contact there. If there's no website, call the organization and ask to speak with an office manager or a social worker on staff. Introduce yourself as someone doing this work in the community who's looking to make referrals from the clients that you're working with. Briefly explain to the organization or to their representative what it is that you do and that your organization is tasked with. Try and establish regular contact with the organization so that you maintain that relationship that we talked about. Offer your help in the form of being a contact for your organization that they could reach out to if they want to refer someone for the kinds of services you're providing. And follow up with a thank you and your contact information after you have spoken with them. And also a great idea to reaffirm that contact by saying, when you've referred someone over and you find out that they've successfully accessed whatever services they need, hey, thanks so much for helping that person. It really seems like they got what they were looking for. Looking forward to working with you in the future, that kind of thing. So just really set the stage and build that kind of what we would call collegiality, or that colleagues kind of relationship with these other organizations. Some of you brought a lot of these points up, so I'm going to just move through them quickly because I don't want to repeat everything that you've said, but pay a visit, right? Ask them at the front desk if there's anyone available who you could speak with about their services. Introduce yourself, give them your contact information. You might not have a business card, but providing your contact information and the organization you work for could be helpful. Ask about services available or more about their programs. Ask for their contact information so that you have that point of contact. And again, always thank them in person, and then again via email or with a letter, thanking them for taking the time to let you get to know their organization. Okay, and then we've again already touched on some of these pieces, so I'm not going to spend too much time here, but ask yourself if you visit the facility, is the facility clean? As someone else said, is the staff friendly? Are these people we want to be referring our clients to? Is the service free? And if so, is it free to everyone? Are there income requirements? Does the facility have payment options if they do charge for services for people who can't pay for the full service up front? Most importantly, ask yourself, if I were in the position of needing these services, would I want to go here? Are people being treated with respect? Are they being treated as though they are valuable members of the community? And you can really judge that best for yourself. And then don't just let your one visit sit there and say, oh, this place is great. I visited them last year. They're awesome, right? Go back, go revisit, and reevaluate if you think this is a place you want to continue sending members of your community. So, to summarize this whole section of this training, to boil it down into 3 points, the steps to adequately and properly serving your members by referring them to services would start with knowing the resources in your community that are available. Then we make the connections to people in those organizations that can be contact people and resources for us. And lastly, and most of you already know your communities, know your clients, know their needs, get to know them if you don't already know them, so that you can really provide resources that are going to be effective for them. Get to know their culture, their preferences, how do they like to talk to people, how do they like to access services. Maybe they have existing connections that can be relied on to help with this process. Or they might have existing resources that they've tapped into that you didn't know about. They might be able to open a door to you to a new organization that you didn't know about already that has successfully helped them in the past. So now I'm going to pass it back to Consuelo, who's going to introduce our final video and discussion questions before we wrap up today.
Thank you. So just a very brief video, and just similar to the other one, kind of listen and think about what kind of resources were identified for this client.
A lot of people wouldn't even think I'm a cook. I'm 40 years old and I'm just learning how to take care of myself. I get up and go to work, you know, I pay bills, and I have an apartment. It's funny because all this is new. When I came out of prison, you know, I was stuck in the shelter system, you know, looking for help. It was scary when I came out, because being locked up for a long time, you know, they drop you off at 42nd Street to Port Authority. I was kind of scared. If I would have never have been with Project Renewal, I'd have probably been in jail, on the streets, doing wrong.
This really is about forming community for people whose community ties have frayed. I think too often for people who are very poor, who may have a lot of problems, who are in the street, we may see them as resisting some of the help that's provided. But in part, it's because of the way that it's offered. And when you offer it in the context of independent housing, where they have the dignity of their own place to live and the choice about what to take advantage of, then you find that people readily take advantage of the support and are very eager to create community.
The chef showed us a great deal, you know, how to make sauces. They didn't teach us more than just cooking. They taught us how to be a team player, how to be accounted for, you know, be responsible for your, you know, your chores, your cooking.
The employment counselor, in working with them, can begin to have them understand that there are certain barriers to them getting and keeping jobs. And then, because there's a cluster of services available, they can introduce them to the mental health counselors. And because it's non-threatening and it's provided in a very direct and easy to access way, people are able then to get the help and the services that they need, so then they can come back around and actually get and keep the job.
So I went to this place called EPRA and showed me how to do an interview, how to come in and walk in and sit and look.
And he came in with the mindset that he wanted to get into cooking. And we showed him how to interview the proper way. And he did that very, very well. And on his first tryout, he got the job.
I'm feeding 500 people successfully. They enjoying the food. Some of the counselors was proud of me because they watched me going to school, getting a job, to paying rent. You know, these like things when you locked away, that's all you have is dreams and your word. And now I'm doing it.
There's greater interest and there's greater commitment to creating and sustaining supportive housing because policymakers have now seen that it's cost effective and that it achieves real positive results. And in reducing costs for emergency services in hospitals and jails and shelters, and in stabilizing people who are homeless for long, long periods of time.
And I'm not asking for nobody's sympathy. As long as I keep doing the right thing, you'll never know what I was. My name is Craig Val. I am a cook. I own my own apartment, and that's my beautiful wife.
So I want to open it up. We can discuss this for a few minutes. You know, what are the community resources that were identified? And perhaps more importantly, the second question, what do you think made this a success story?
That she showed the intent, you know, she was purposeful to help them out. She didn't hand them off.
She didn't hand, I'm sorry, because I had a hard time here, but you said she didn't hand them off.
She made it easy for him to. She made it easy. She made it easy for him. She showed him how to do it. She held his hand and showed him how to make it. Oh, what's the word?
Made it more accessible.
Made it more accessible for him.
Yeah, exactly. Anyone have anything to add in Schenectady?
I think it was.
This is Schenectady.
That's what you just said.
Oh.
So I meant like if you had it, I didn't want to switch over to Syracuse. You know.
I thought it was like, does anybody in Schenectady have anything?
I was gonna say.
While you guys are still unmuted,
I think an important thing they did was allow for options. So many times, especially people coming from that situation, have been told and forced into whatever they have to do, and that makes you feel less than. It's designed to make you feel less than. So one of the ways of making them feel back integrated in society as a community is we have to give them options. We have to give them options that they feel comfortable and supported in taking. He felt comfortable being a cook, not because somebody was like, oh, yeah, I guess try it. No, but because someone looked at him and said, not only can you do this, but you can succeed and be successful and great at it. You know, you don't know. We might see that guy on Iron Chef one day or something. But, you know, that is offering those opportunities without limits. Saying, okay, here you are. You're just going to be a line cook. No, you can be any cook that you wish to be and go from there. So
that's a great point. They talked about like independence, dignity, and I like what you're bringing to this, giving them options, right? And he talked about how he's serving 500 people, and you clearly see taking pride in his work. Does anyone in Syracuse have anything to add, or anyone on the call?
Sure, Cliff Ryan.
Yep.
Him embracing the aspects of people stepping up with the resources to help him was very important. He identified, you know, some of his issues he was dealing with, you know, and reintegrating back into society, and took the initiative to step up to the plate and embrace those who stepped up to try to help him. That's very important for an individual who's coming out of a situation such as his, for you to embrace the people who are trying to help you in achieving and succeeding. And he went on to do great things because he took the time to embrace people who took the time and the initiative to help him.
Yeah, that's a really excellent point. Thank you.
Mr. Ali.
One other thing is that, and Clifford brings up a very good point. You know, it really took some initiative upon the resource to contact him, because as he stated, he got dropped off at 42nd Street. He was scared. So it was incumbent upon whatever resource that contacted him to be open enough for him to accept it and to take that challenge to become a cook and to learn how to interview in order to be successful. So it was actually the success of the organization as well as the individual to be able to bring those resources to him for him to accept them.
Right, exactly. It's kind of both, right? The way they approached it, obviously, he was receptive to, but also he took the initiative and was able to, you know, access those resources. And to tie this all back into kind of the vaccine piece, we know that some positions now you are not going to get hired if you're not showing proof of vaccination, right? So if that's if that's one of the many barriers, and we can go in the community and help people see the value, not only because to protect, like I was talking about yesterday with herd immunity, things like that, protecting people who can't be vaccinated, but also just as a help with their career. I know personally know people who are in programs and are no longer in the program because they can't do the clinical in healthcare because they're not vaccinated and they don't get vaccinated. And you know, it's a difficult situation. There's a lot of reasons behind that, and it's as we'll, you know, throughout this training, we're going to get to this a bit more, like when that is a really difficult situation where they really are against it, kind of having that conversation, keeping the door open, having follow-up conversations, not necessarily going to convince someone right away to turn them around, but as a piece of this, I just want to tie it back into the whole vaccination, because that can be a problem right now. And you know, thank you guys very much for your participation with that piece.
Awesome, thanks, Consolo. So I will take us through the end here. So we will have a period for questions if you have any. So some final thoughts here. Some resources require a referral. Others can be accessed without a referral, and it's important to know if the location that you're referring someone to takes walk-ins or if they need to schedule an appointment. You as community health workers can play an important role in helping community members access the resources that are out there in your communities. A resource directory is a vital tool that will streamline the referral process and ensure access to all the resources that are in your community. You want to work collaboratively with these community-based organizations in order to better serve your community members. And most importantly, you need to know your clients and their needs so that you know what resources to bring up to them and offer them referrals to. So we've got a few minutes for questions. If you have any questions and you're on the line, please unmute yourselves. If you're in Schenectady or Syracuse offices, wave your flag or raise your paper, whatever you need to do to let us know that you have a question. We're happy to take any questions at this time. Okay, hearing no questions, before we let you go to do the evaluations for this session, just want to, again, kind of get your impressions, your feedback. What did you like about this session? What could we do better at? We want to know what you think so that we can continuously improve this program.
Personally, I felt like it was super collaborative. Like just talking specifically, just the last portion that we did, about like what are resources, how do we find them, what can they be used for, how to compile them. Like, I mean, like it just I have like 5 pages written out, just like stuff like ideas from Syracuse, ideas from in here that we were having, like, so that was really, really good.
That's awesome. And I think one of the biggest things for us is that there is so much knowledge in both rooms that we just want to help uncover and help you guys share that knowledge in any way we can. Any other feedback from Schenectady or from our Syracuse location?
Oh, they're good here.
Awesome. Well, then we will let you go to complete those evaluations and enjoy the rest of your days. We will be seeing you back here tomorrow morning. Is going to be with Emmanuel and myself. We'll be talking about basic communication skills starting at 9 a.m. tomorrow. Looking forward to seeing you, and everyone have a great rest of your day. Take care.